Joining me is Dr. Wayne Phimister. He's a family physician, chronic pain expert, and an author, and he's here to talk about the cause of physical pain or chronic pain. Welcome back.
Thank you, Christine.
To Doctor's Corner. So what is soft tissue tightness?
Soft tissue tightness is a universal phenomenon that happens in our bodies as we age. I think we're all less flexible when we're 60 versus when we're 20, or most people. I find that tightness happens from several different ways. One, it can be injuries. One can be stress in the body. Another can be surgical scars in the body. But aging is probably the number one thing.
Aging.
So, yeah.
So we can't really get away from it, right? But there's a way to help.
Yes.
And that's...
I think initially, basic stretching, yoga is great. Walking, running, just your aerobic type exercises are wonderful, and I think we should all be doing that. And then, if that's not really helping, say the tightness is associated with some pain, then the next treatment modality is like physiotherapy or maybe massage. A good old massage is wonderful. Chiropractic treatments can be very helpful, especially the soft tissue approaches to tightness. But what I find in my practice is these modalities are not getting the patient to where they want. And then they come and they share their story, and I've done their evaluation, and then I just explain, look, the tightness is coming from the fascial plane in the body. And the fascia is, another word is like connective tissue in the body. And I must tell you this story. Only last year, and the articles came out in March 2018 from Mount Sinai in New York and also in the University of Philadelphia. And they were able to show a new organ in the body called the interstitium. The interstitium. And it's funny because this was a brand new organ that they were able to look at with a special microscope inside the body, and they could see these layers of collagen, or like connective tissue, and fluid. And it was like a matrix of tissue that was dynamic and moving. So they thought, well, it's moving, it's got a structure, it's probably got a function, and therefore, by definition, we have a new organ. So here we are in the modern world, and we're discovering new organs, which is phenomenal.
Yeah.
But it's fascinating because what happened in my journey of discovering this layer of fascia and thickness was 4 years ago when I swapped from an acupuncture needle into the muscle. It's called dry needling or intramuscular stimulation, something that's done a lot in BC and also in Alberta, trained by Dr. Chan Gunn from Vancouver here. So I trained with Chan, and we understood that by releasing the muscles with an acupuncture needle was effective. But what I discovered 4 years ago is when you use a medical needle, it's different because the shape is different. And when you put these needles in, you literally cause little holes in the fascia. And these little holes just relax it just a little bit. And how I think it works is these little nerves that are in these layers, called the peripheral nerves, they're compressed by the tightness. And when you put the needle in a few times in, say, one area, then there's a relaxation response happening. And the blood flow to those tiny nerves increases. And then the nerves get a blood flow, they get oxygen, they get nutrients, and literally they start to recover, they regenerate. And I think that's one of the reasons why the pain levels goes down. Because when you have a compressed nerve, imagine your nerves being squished, it's really sensitized. Where if the nerve is more relaxed, there's more blood flow, there's less pain associated with it. So that's my experience with treating with trigger point injections with a medical needle, and I really have phenomenal results.
That's wonderful. So how does it make you feel to help others? Because you are so passionate about what you do.
Yeah, it's a great question. I love helping people. I came into medicine many years ago, about 30 years ago I started now, and the real objective was to help people with a challenge. And the ironic thing, 30 years later, is exactly what I'm doing. I'm helping people, and the challenge is finding solutions for chronic pain. Because chronic pain can be mastered, I believe, but there's just more than one way to do it. So here we are, talking about it on a TV show all these years later, but it's just wonderful to get that satisfaction from helping folk.
That's wonderful. And tell us about Advance. trigger point
Yeah,
injections.
okay. So advanced trigger point injections is a description of trigger point injections that I made up myself because I wanted to say something more than trigger points, because by definition a trigger point, and there's two types, there's the active point and there's a latent point, but to keep it simple, patients have got painful muscles, they've got knotted muscles. For example, most of us, if you palpate the trapezius here, you're going to feel a bit tender, and these knots are very common in pain situations, but also in non-pain situations. But in a traditional trigger point treatment, you go into the knot, you release the tension, it elongates, and therefore the muscle becomes more normal in its function. So that's classic trigger points. And typically, if you're treating that, you're only looking for 1 or 2 trigger points. But the reason I bring in advanced is because over and above this, we must be thinking the whole body. You know, we know the body is interconnected. This fascial plane we've mentioned literally runs from your head to your toes. It goes around every muscle. It goes through every muscle. And it connects the muscles to the muscles. And that's why commonly, if you've got, say, neck pain, you may also have a bit of low back tightness or pain as well, because this layer is running all the way up and down our body. And by treating the different areas of the brain, by treating different areas of the body, we're literally releasing the fascia. So that's why I like to call it advanced, simply because it's more than one area. And I've got a few tricks up my sleeve on how to optimize treatments as well, like the size of the needle, like the depth of the needle. So these are things I'm constantly reviewing with every patient to make sure I get the best outcomes.
Yes, and any tips for those who are watching to help themselves, and if they can't see you?
Yeah, I think number one thing is to be active, be always on the go, and have an exercise routine, but work within your limits. You don't push it. Don't go to that next level. I would just, if you're walking or running or in the gym, just work within that level and maintain that, because not that it fixes it, but it does maintain people at a good fitness level, which I think is an important prerequisite for the treatments.
And then when patients come to see you, do an assessment first, and the feedback has been wonderful.
Yeah. It's, I did some audits over the years, and with a collection of 2 years of audits and different sized needles, I found an 89% success rate with people. And that's them saying they weren't getting help before and couldn't be helped to the degree they wanted, to the point where they're saying they're good and excellent. And many of these patients, well over 50%, maintain the effect after I'm finished for months, even 10 months after. One audit, I phoned them up 10 months later and says, "How are you doing?" And these results were lasting a long time. So overall, I would say most people can get benefit from the trigger point injection technique that I utilize.
What happens if you're scared of needles?
Good question. Most of the time people are face down on the bed or facing away from me, so it's not too much of a problem. If they do have a huge phobia and they're willing to work with me, then I work them through that, and I actually use this situation to overcome it, because phobias are all about illusions of the mind, and they're not actually real. So when they're faced and we move forward, then they can be overcome. Although I don't really push that. If patients really don't want to do it, and there are some patients that's more appropriate not to do trigger points, and I just focus on the mind-body connection or the nutrition approach.
That's wonderful. And if they want more information, where can they go?
For more information is my website. That's WaynePhimister.com. That's WaynePhim for mother, ISTER.com. And trigger points, there's trigger point manuals that that the layperson can find out. I would say talking to a good massage therapist is maybe the most practical way, because they have likely got these pictures up on the wall of trigger points and the distribution of the pain down the arm or down the leg or around the body. So they're dealing with this all the time. So they're a great resource as well.
Thank you very much for coming on the show, and we'd love you to come back.